Please welcome Altuna Akalin, Berlin Institute for Medical Systems Biology, Max Delbruck Center for Molecular Medicine in the Helmholtz Association. Deep Learning for Cancer Diagnostics.
So we are looking at, if it works, cancer and normal genome here. As you can see, normal genome or cancer genome has expanded itself. It has some chromosomes are elongated, some of them duplicated itself, and they also gained thousands of mutations that impair functions of critical genes. And I'm sure many of you in this room have known someone who had cancer, or there are people in your family who has cancer, and you know these people. So, and this disease mostly affects the developed part of the world. This map shows the incidence rates among the world. So you can see most western parts of the world have suffer from this disease, and US alone spends 40 billion on this disease every year for treatment and diagnosis, and there are 17 million cases each year. And I want to look at how doctors make decisions to diagnose this disease and if there is something we can improve. So doctors look at pathology reports, tumor location and imaging, and tries to decide what to do with the cancer patients. But there is a big problem here. As I said, cancer is a disease of the genome, and the normal practice doctors don't look at the genome at all. And this is a problem because genome has information to guide therapy. It can help us do more precise diagnostics. But of course, there are critics about this, so people will say it's too expensive. I can tell you it takes only a couple of €100 for us to have enough information to guide therapy. They say it's not actionable. But I can tell you that 90% of the drugs today on trial are targeted, so if you know the genome or more information about the genome, we can help these patients. With this in mind, we developed an AI platform which will support clinical decision making. It integrates lots of genomic information, drug information, and disease models information, and helps us arrive at an actionable, insightful patient report where we can look at what, oh my God, anyway. Sorry about the slides, but the report shows what type of drugs are approved for these patients. We can predict how efficient they will be. We can look at immunotherapies, and we can predict survival better than other clinical markers. And of course, we can say a lot about the microenvironment, but also with the single-cell technologies developing, we will do better at this. And if you want to know more about me or my lab, you can go to my web pages, but also this project, if you want to specifically know about what we are doing, we just launched a website called arcas.ai, which specifies details about this project. Thank you.